My name is Caroline, and I am one of the Enhanced Recovery nurses. Your well-being is really important both before and after your operation. Small changes can make a big difference not only to your recovery, but for your long-term health. We are now going to give you some advice on how this can be achieved. Surgery and anaesthetics will affect your lungs. Smokers have a much higher risk of developing chest problems or infections. Smoking also delays wound healing and may increase the risk of an infection after your operation. If you smoke or vape, now would be a good time to stop. If this is not possible, then try to cut down. We would encourage you to cut out alcohol before your operation. If you can do this for a few weeks, this would be great. The longer the better. Alcohol suppresses the immune system, which is your body's defence against infection. If you do drink a lot of alcohol and feel it may be a problem either before surgery or when you are recovering, then please contact us or your GP for help and support. There have been studies carried out recently that show good oral hygiene will reduce the risk of getting a chest infection after your operation. In the run-up to your surgery, we want you to brush your teeth twice a day and use an antibacterial mouthwash. It is best to use the mouthwash at a different time of day so the fluoride from your toothpaste isn't washed away from your teeth. Remember, this includes time when you are nil by mouth prior to surgery, as this is just before your anaesthetic. You should keep up this regime until you are discharged home and after your surgery. If you can get in to see a dental hygienist or a dentist for a professional clean before you come into hospital, then all the better. We carry lots of bacteria on our skin. This is normal and causes no harm, as skin acts as a barrier to protect us. But on the day of your surgery, we want your skin clean to reduce any risk of bacterial contamination during surgery. Please make sure you have a shower with a gentle soap or shower gel, paying particular attention to any creases or any areas where bacteria tends to build up, like groins, under your arms and your belly button. If you have been to pre-op already, you will have been told what medications you should take or stop taking in the days and weeks before your operation. It is really important that we know exactly what you are taking for your safety and to make sure your operation can go ahead as planned. If you have any questions about your medications or you are unsure of the instructions you have been given, please contact us. We would much rather deal with it now than on admission to hospital, which could cause delays in your surgery. Also, if you take any herbal remedies, cannabis oil or any other drugs not prescribed by a doctor, it's really important that you let us know, as this can affect how we deal with your pain relief after your operation. Research has shown that a good sleeping pattern is important for the body's response to stress and inflammation, which both happen during surgery. Ideally, try to get 7 to 9 hours sleep every night. If you struggle sleeping, we recommend that you don't drink alcohol, that you avoid screens such as phones, TVs and tablets, etc., and try to make sure your room is dark and cool. Exercise throughout the day and maybe try mindfulness. It may be that your diagnosis or your operation are causing some worry and stress. We understand and we realise that this process through diagnosis, treatment and recovery is a bit of a roller coaster. Please try to remain as positive as possible. We would encourage patients to use the time before your operation to follow our guidance and concentrate on the practical things, like chest training, an activity that could have a beneficial effect on your recovery, but also get you prepared for life after surgery. Continue talking to your family and loved ones about how they can help. We are also here to support you. Please contact us to discuss any issues, and if we can't help you, we may be able to direct you to someone who can. In the time before your operation, try to continue with life as normal as possible. We would like you to look at your home and surroundings and prepare for your discharge. Try to reduce the problems when you go home. If furniture needs moving or rooms rearranging, do it before you come in. Make things easier for yourself. Think about cooking some meals and freezing them, or buy some in for the days when you might not feel up to cooking. Plan ahead. It reduces the risk of us not being able to discharge you home when you are medically fit. If you don't think that going home following surgery is going to be safe for you for any reason, then you need to tell us, and we can make sure the right services are aware from the start and avoid delays in your discharge.